So we're here continuing to speak about research papers and trying to pull possible clinical applications out of them, keeping in mind that the frame of the question that the research is investigating doesn't necessarily apply directly into clinical life. However, we can attempt to pull some information out of it. Now, the paper that we're going to talk about today, and we'll link to that in the notes below the video, is that we're looking at an idea that, as far as motor learning is concerned, one of the keys that seems to help, or as far as investigations are concerned right now, that seems to help, is giving the person undergoing the motor learning task an external frame of reference. So you don't seem to get good results out of telling them they want to feel their arm doing this, doing that, whatever it may be. You give them the outcome goal, or something similar to the outcome goal. You want the hand to touch the patient's knee, right? So you give them the target, you give them the outcome goal, and it seems to go well. So something that this could look like with respect to manual therapeutics, if we're teaching something such as a leg rotation, is what we want to show that we want the hip to come into flexion, right? So you get general hip flexion, and then we want rotation of that, okay? So there are varying ways to show that. So we can show the skill in full context, such as this, which we've shown previously. We can show the skill in full context, but if the person undergoing the motor learning task is considering all of those steps, sometimes they don't seem to go as smoothly through the motor learning process. It may be advantageous to show them something such as this. This is another way to do it. I just want you to bring your knee to your chest, and then just take it around in a circle. Okay. We can show them that that's the goal motion. Let the leg down. So we can use that as part of a demonstration. We can show them the goal motion is to get the patient's leg essentially to do that for whatever reason, whether it's to address the soft tissues in the lumbar column, whether it's to address the 2 to 4 degrees of motion that the innominate may have in relation to the sacrum, whether it is to address motion at the coxofemoral joint. Regardless of what the aim is, show them the goal movement. Okay? So say something such as attempting to create rotation generally of the pelvis in a supine position, which isn't ideal because the table gets in the way. So ideally this would be more advantageous in a seated position or in a lateral position, but we can do something such as this. Okay? So we can pull towards us, to pull this side of the pelvis away from the table and essentially rotate it backwards on this side. So in the case of what we're doing here, we're pulling the left side of the patient off the table so that we create, in totality, a right rotation generally of the pelvis in relation to the rest of the body, or in relation to the lumbar column, or wherever you want to put your WRT or your with respect to. The idea being, again, we can show people the full sequence in full context, but it may be advantageous to also, as an adjunct, show them, so let your leg down, okay, to show them something without the practitioner. Okay, bend your knee. What I want you to do is just kind of roll your leg towards me. Or keep your foot on, but just roll towards me. So that's the general goal motion. And we can also instruct people as to where to look, what motion they're looking for. So I don't want them, it may not be advantageous to have a student looking at the motion of the knee. It would be advantageous to train them to look at the structure they're attempting to move, and then again using their peripheral vision to make sure that it doesn't move farther than they want it to. So that might look like something like teaching somebody to look here at the belt line, generally speaking, and then once they've created contact, don't let the movement go beyond the superior border with respect to the patient of my forearm. Anything beyond that may not be advantageous depending on what I'm trying to do. If I wanted to rotate through the lumbar region, generally speaking, and again, this may not be in a granular sense what's happening at each joint, but it's the general concept. I would have the student place their hand higher so that they understood that when they're here, they move until they feel motion at their fingers. Here, move and see. Right? We're talking about the concepts of multisensory integration here with talking about moving and seeing. And then there, so if I start to see movement of the patient beyond here, I know I've gone farther than I wanted to. Okay, so that general concept of utilizing not only demonstration of the movement in full context, but also instructing the students and showing them in some way as to what the goal motion is. So you give them an external frame of reference. That may be very well advantageous in improving the motor learning process.